Hi everyone, good evening and welcome to Issues and Inspiration. This is Marivir and we are live here on Facebook and YouTube. And with me, of course, is my friend Grace, who is not on Earth right now. She is in Jupiter. Grace, can you
Hi,
hear me?
Marie. Yes, I can hear you loud and clear in Jupiter. How are you?
I'm good. I miss you.
I miss you
What
too.
happened to you? Why are you there?
Well, somewhere out there. I'm somewhere out there. No, no.
Yeah, so
Yeah,
we have a very
excuse
important
me.
discussion
Yes,
this
that's
evening.
why. Yes, that's why even I'm not feeling well, I'm here to join you because I know we'll get a lot of updates and
Mhm.
learn a lot from our guest tonight. So yes, to our viewers, excuse the picture for now. I will join you again live with my beautiful friend here on our next broadcast.
Oh my God. So you want to introduce our guest already tonight?
Yes, she has been our guest for like a couple of months ago, and we're so happy to have her back.
Mm-hmm.
And let me introduce to you Miss or Dr. Elvy Barroso. She's a medical doctor. She also has a PhD in nursing, a professor of nursing as well, and works at the Department of Health here in the United States. So welcome and good evening, Dr. Barroso.
Hello, Doc. Good evening and welcome to the show. Thank you again for your time with us.
Good evening, Grace and Marivir. Thank you for inviting me again.
Good evening
It's
po
amazing
and
to have
Happy New
you.
Year. Yes, it's always our pleasure to have you. And Marivir, we were supposed to broadcast on Friday, right? But since
Mm-hmm.
this this topic has an urgency, so we're here tonight
So
to
we're
yeah.
going live for
Mhm.
people to be able to participate. So
Yes.
thank you, Grace. Even if you're not feeling well, you're still like the marching soldier.
Yes, inspired
Thank
by
you.
you, of course.
Oh my God. I hope not coerced. So
Okay,
you
so
may ask Dr. LV the first question, Grace.
yes, Dr. Elvy. So, COVID-19 is still here, unfortunately, right? We thought we're going, you know, back to normal on our second year, but still rampant out there. So, how can COVID-19 spread when you are asymptomatic?
That is a very good question,
Mhm.
Grace. So, once the person has the virus in the body, whether that person shows symptoms or not, can spread the virus to somebody who is in close contact with that person that is infected with the virus. So, there's about 1 in 5 people infected with the virus that will experience no symptoms. They can't spread the virus to people more than those with symptoms because those with symptoms will be cautious about their condition, while those without symptoms will not be cautious since they don't think they are sick. According to study, asymptomatic carrier or those who are infected but do not show symptoms seems to clear the virus in their throat faster and are infectious for a shorter period of time. And also, in addition, their immune system might be able to neutralize the virus more rapidly than those that show symptoms.
Thank
Oh.
you. Thank you so much, Doctor. You have a follow-up question, Marivir?
So, Doc, my question is the surge, the variants. How do they evolve? Like there was Delta, now there's Omicron. Why do variants happen?
That is also a very good question, Marivir. How does variants develop? The
Mm-hmm.
virus mutates naturally as a result. New variants emerge. Other variants disappear while others persist. So the first variant identified in India is called Delta. So it
Mm-hmm.
spread easily than other variants. It may cause severe illness and death than other variants, but the vaccine is effective at preventing severe illness and hospitalization and death. And this Delta variant responds to monoclonal antibody treatment. The second variant has been identified from South Africa is called the Omicron. It spread more easily than the other variants. It can also cause severe illness among unvaccinated, but causes breakthrough infection with mild symptoms among those vaccinated. The vaccines, though, are expected to be effective against severe illness, hospitalization, and deaths. And some monoclonal antibody treatment may not be as effective against the infection with Omicron. So other variants like the one identified in France is not of concern according to the World Health Organization. And also, by the way, also a research that was done by the Oregon Health and Science University that was published online in the Journal of the American Medical Association. The study suggests that individuals who are vaccinated and then exposed to Omicron with a breakthrough infection can develop a super immunity. But, this research needs still further study to support their findings.
That sounds very, very optimistic, Doc. And in
Yeah.
fact, I remember I asked you if I belong to that sample population already because I had my infection, and that was just like a few days after I had my booster. I don't know if I'm part of it to have a super
Yeah.
immunity.
Most probably, Marivir, it was an Omicron variant.
But doc, there is still, when somebody still tests negative, but the symptoms are still there. What is that? What does that mean?
Well, with Omicron variant, according to research, when you get exposed, you may still be asymptomatic on the second day, but infection starts and symptoms may start to appear on the fourth day and the test becomes positive. We say that the best time to test is on the sixth day,
Oh.
and infectiousness may end on the ninth day and symptoms usually resolve unless you develop some complications. So you may already test negative because the viral load is no longer enough to be detected by the test
Mm-hmm.
and may not be enough to infect others. However, you may still show lingering symptoms because the virus can stay in the body for 90 days.
Okay. So for 90 days, the person will still like feel sick and have some symptoms, doc?
Hopefully, you no longer manifest symptoms after the 90 days unless you develop complications in the lungs.
Oh, that
And
sounds
that can,
scary.
yeah.
What complications, for example?
Well, complications like you can develop bronchitis or pneumonia,
Oh,
and that means that, it has affected your lungs more severely than just, you know, having a mild cough that goes
so
away in 8 to 9 days.
you need to go to the hospital then, or consult with your doctor.
Well, when it comes to you want to know the management of
Mm-hmm.
how to manage when you have. Okay, so to manage the symptoms of COVID at home, you need to monitor your symptoms carefully. Okay, if your
Yeah.
symptoms get worse, you have to call your healthcare provider immediately. Since among the symptoms of COVID, the one that we are concerned about is the dry cough.
Mm-hmm.
So, how do we loosen that dry cough? You drink plenty of fluids, you do steam inhalation, you do deep breathing, You can do the home remedy by drinking ginger water with lemon. You need to avoid lying down. You need to sit upright. When
Oh,
you eat, avoid lying on your back. Instead, you lie on your side and you lie on your stomach. So if you start having difficulty of breathing, you need to call 911. And while waiting for help, one thing that you can do is to do a pursed lip breathing to keep your airways open. So pursed lip breathing, it moves oxygen into your lungs and take out the carbon dioxide that is trapped in your lungs. So it relieves shortness of breath. So how do you do pursed lip inhalation? Pursed lip breathing is to inhale or breathe in slowly through your nose with your mouth closed, then exhale or blow air slowly with your mouth pursed. That's why it's called pursed lip breathing. So it's like
mhm.
you're going to whistle or blow the flame of a candle slowly. So pursed
Mm.
lip breathing also helps relieve if the person is anxious. So that's what you do when you have difficulty of breathing. Now,
So, mhm,
if you have pulse oximeter at home, you can use it and it will tell you the level of oxygen in your blood. So
mhm.
monitor your readings, and if you see it's going down to less than 95, call your healthcare provider. Anything less than 92, you need to call 911. Now, other ways to manage your symptoms at home when it comes to taking vitamins. There's no specific recommendation from the National Institute of Health. However, we believe the vitamins are beneficial to overall health and immune systems. But again, we have to be careful in taking the right dose since you might end up causing more harm than good. So, the cocktail of vitamins that you can take to boost your immune system while you have COVID symptoms are zinc, 40 to 50 milligram daily, vitamin C, 500 milligram 2 or 3 times a day, and vitamin D3, either 1000 or 2000 IU daily. So, those are the vitamins that can boost fight against COVID 19.
Grace, do you have a question?
Yes, yes, Marivir. Doc, is there really a Delta coronavirus?
Well, yeah, so uh, the Delta coronavirus, um, hold on. It's actually, it says Delta and Cron. So it's a
Omicron.
combination. It's of Delta and Omicron. So it's basically a mutation that combines both Delta and Omicron variants. But according to the World Health Organization, Delta Cron is not real. And
Mm.
it's likely due to sequencing artifact.
Mm-hmm.
Okay, so according to another doctor also said it's due to contamination of Omicron fragments in a Delta specimen. So it's not real.
Okay, thank you, Doc.
You're
Because
welcome.
at some point I got worried because I read an article about it saying it originated in Greece, apparently. The Delta, no, Delta coronavirus came from Greece, apparently. So that's not true. It's a fake news.
Yeah, there's so many fake news
Mm.
going on right now. But, you know, we have to read the news that's coming from reputable organization like the Center for Disease Control, the National uh, Institute of Health, the Department of Health and Mental Hygiene, and also those experts that really know what's going on.
Okay,
Yeah.
Thanks, Doc. That's a good point. All
So,
right.
Doc,
Mhm.
mhm. My question is, how reliable are home tests, and what are the measures that we're supposed to do right now? We received email from the federal government that we can request for home test kits. So are these really reliable, and what is your advice on this?
Well, the most reliable one is the PCR test.
Mm-hmm.
The rapid test uh, can only detect if the viral load that's in the body is high. But once it goes down, it can no longer detect the virus. While the PCR can detect up to the 90 days because the virus stays in our body up to 90 days. That's why sometimes you still manifest symptoms, lingering symptoms, because it's still in our body, according to research, up to 90 days.
So in that 90 days, doc, you are still like contagious?
Well, that is a very good question. No, you're not anymore contagious because the infectiousness starts from the 6 days, 6 days out, uh, up to
Mm-hmm.
14 days, and then it's no longer detected by the rapid test. That's
I
why,
see.
yeah, that's why you may get negative tests even after a week. But if you do the PCR, it may still be positive.
So, Doc,
No, in oh,
yeah, I
go
have a
ahead, Grace.
follow-up, Marivir. So, for those who
Mm-hmm.
are traveling abroad, let's say they had the virus this month, and they decide to travel like in 2 weeks' time. Is that safe?
That is a very good question.
Hmm.
Yeah, we say that ideally you should be quarantining up to 14 days, but it was
Hmm.
lessened now to 10 days.
Right.
There's so many uncertainties in this virus. Uh, we can say that, you can still be infectious up to the 10th day.
Hmm.
That's why if you really want to know if you're still positive or not, you have to do the PCR. The
Okay.
rapid test will tell you you're already negative, but it it can give you a
Mm-hmm.
false sense of security that you're no longer infectious, but you may still be infectious. So it all depends upon it's individual. That's why
Mm-hmm.
it's better to quarantine for at least 2 weeks, and also the symptoms can also last up to 4 weeks.
Hmm.
So you want to be cautious. You know, you want to make sure that those around you are safe because of you. Not that you wanna travel because you're already negative, but you don't know. Most especially if you show some symptoms. Although we have asymptomatic carrier, but if you show symptoms, that means that you still have the virus in your body.
Yeah,
Mm-hmm.
you said
Remember,
90 days, right? It stays in your
yeah,
system
up to
in within 90 days.
yeah.
So maybe, Grace, we should not see each other for 90 days for
Yeah, that's what I'm
anybody
trying
who
to
have
point
had
out too, right? So if
Usually,
someone in the family got infected,
yeah.
right? So,
But you can, as long as you do the precautionary measures. The
Mm-hmm.
best way to prevent you from spreading is to use a mask.
mhm,
And now they recommend to use high quality mask, because
okay.
if you are
Mm-hmm.
wearing N95, that means that you cannot really spread the virus because it's trapped by the N95. That also protects you. If you're using N95, you don't have coronavirus. it protects you because it's not going to go through the N95 mask. If it's well fit in your face, it should protect you from getting infected.
But doc, sometimes the N95 is really so tight. It's so hard to breathe using it.
Because, Marivir, ideally, the N95, uh,
Mm-hmm.
you should be tested. We call it fit testing. There are many
Oh, okay.
sizes. There are many sizes, and if you have a small face, you need to be given a
Mm-hmm.
small size. If you have a medium one,
I
you
see.
need the medium one, and if you have a bigger face, you need a large one. But the one that we have that's
Mm-hmm.
circulating is just one standard size.
Mm-hmm.
So if
Mm-hmm.
you're skinny, if your face is skinny, it would not fit you thoroughly. So again, it all depends upon the type of mask that the type of the quality of mask that you use. It can be high quality, but if it's too big on your face, you know,
It's not
the
useful.
virus can still, you can still inhale the virus. It may be
Okay.
too tight also because you probably need a medium size. So that's why, it can give marks on your face. That's why it's very important to use the right size of the mask that you're wearing.
I see.
Either
Thank you
it's
that. Thank you on that,
either
doc.
it's the N95 or the KN95.
Correct. So
We
there
have
it
a
comes in
question
sizes
from a
already.
participant here, Grace.
Yeah. Yeah. No, I have a follow-up question on the sizes of the
Oh,
KN95.
okay.
So it
Go ahead.
comes with sizes now, the N95 and the KN95. And will the government provide free KN95 masks?
Yes, so far the government has already ordered those type of masks for the public.
Okay, great.
Awesome.
So
That's
how
good.
where do we get those?
When it's already out, you will learn it. You will just like the home kit. It was advertised today on television. The link was already out. I even forwarded to Marivir. I
Mm-hmm.
forwarded to you the link to sign up for the home kit.
Mm-hmm.
So you can just spread it.
Thank you, doc.
Yeah.
Yeah, a lot of friends forwarded it to me, so it's very everybody's like so supportive of each other.
Right. I
Thank
have
you.
ordered mine already, so I hope to
Yeah.
receive them soon. Because I've been buying from the pharmacy, so it costs
Yeah,
a
and
lot of
it's
money. Yep.
expensive.
Mhm. It's
Yes. Yeah.
expensive.
Also bought from Amazon. It's $17.
Yeah.
For
In fact,
for
also
one,
from Dwayne Reed, I got it 23.99 doc.
Oh,
yeah.
It's
But it
good.
comes
more
with two
expensive.
test kits, right?
Yeah,
The
it's two. That's
23,
why.
yeah.
Yeah.
Mhm.
But the single one was like I thought I got it for like $9, Grace, at one time.
Oh, okay. Yeah.
Yeah, we
That's
have a
good.
question from
Yeah, from
a
Jobber.
friend, Jobert
Mhm.
Opulencia. Dr. Elvy,
Yes.
there is an increase on the number of people who have started thinking that vaccine will kill them and have even stopped taking the booster. What is your opinion on this? They say that even if you have the booster, you can still get infected with COVID.
Yeah.
So even if you had two
Yeah.
shots of the vaccine. So
Yeah. I
what is your
know
take
that
on this, doc?
time about the vaccine killing people. I didn't even read because I know it's a false news. So,
Mm-hmm.
the whole concept of boosting immunity against infectious disease has been well established. So, do you
Yeah.
remember the shots that were given to our kids when they were young? The shots at 2, at 4, at 6 months of age. Then we give the booster shot at age 4. Then we boost again at age 12. Then we
Yeah.
get the booster shot for measles, for mumps, and rubella before we go to college. We also got the booster shot for tetanus, for diphtheria, for pertussis. To every woman who's pregnant, we boost all the time. So it's the same concept of boosting immunity for COVID-19. Booster shot improves immunity. So
Mm-hmm.
remember the goal of a vaccine is to prevent serious disease and prevent hospitalization and death. Booster shots should be given at least now at 5 months after the second dose of the RNA messenger uh, mRNA vaccine. And because of the highly infectious Omicron variant, other countries like Germany, they changed their recommendation for booster shot. So when we started giving booster shot, we started booster shot 6 months after the second dose. In Germany, they shortened the 6 months to 3 months.
Oh,
So what are the updates that we have in US? It was we also changed from 6 months to 5 months now. So booster shot really improves immunity. Now, about the third dose of the mRNA COVID vaccine, those are the ones that are recommended for people with weakened immune system. So people with weakened immune system may not develop enough immunity after vaccination with 2 doses of the mRNA. So additional dose might improve their protection against COVID, and that's the booster. And
do you
it's
think,
yeah,
uh Doc, do you think that the COVID vaccines and boosters will become like the flu vaccine that we take every year? Are
yeah,
we headed towards
yeah.
that
That's
trend?
yes, just like what I explained to you about the concept of boosting.
Mm-hmm.
So we are on the third dose now. Fourth dose is coming already. Actually, Israel would be the first country in the world to offer the fourth Pfizer vaccine doses to age over 60 and those with immunocompromised immunity and healthcare workers. But US, probably in the next week or two, the fourth dose of the mRNA COVID-19 vaccine is also starting. And it's also recommended for
Mm-hmm.
immunocompromised. When we say immunocompromised, who are those? Those with active treatment for cancer, those that receive
Mm-hmm.
organ transplant within the past 2 years, those with moderate or severe immunodeficiency, those with advanced or untreated HIV, those with active treatment or are on high doses of corticosteroids. So this fourth dose will be given 5 months after the third dose of the mRNA COVID 19 vaccine.
So definitely that would be about towards the middle of the year or third quarter of the
Oh,
year, Doc.
yep. So
I
five
see.
months after the third dose, we will be starting the fourth dose.
Is it going to be a Pfizer booster
It's going to
or
be Pfizer and
Moderna?
yes.
So let's prepare for that
Yeah.
within like
It's
in
it's
6 months.
it's to be given. We're gonna start to give it to those who are immunocompromised, not yet for the public.
Oh,
I see.
all right. That's
Oh,
good. Good to know. Thank you for that information, doctor.
Sure.
Yeah.
Doc, I
So
have
that's a good
a
update.
an innocent question, if I may, if I may say this.
Sure.
Like
Sure.
when the pandemic started, it immediately attacked the people who were already immunocompromised, and then now the children are also being attacked. So what, why is this like that? Like, isn't it that the virus attacks everybody regardless of age, or why is it something like it's being segmentized according to age or
Uh,
body condition?
it's all about the immune system. So
Okay.
it attacks those who are immunocompromised because their immune system are defenseless. They're not that strong to fight the virus. When it comes to children, children have an immature immune system. So they
Mm-hmm.
are also considered having a not really weak, but because of the immature immune system, they do not have that defenses. like the defenses, the immune system that of an adult. That's why they're more likely to get exposed and infected. And also remember, they've not been vaccinated. We only started vaccination from 5 to 11 just in January.
Yeah.
So, and not all parents are receptive to the vaccine. There's so many hesitancy towards vaccinating the kids. There's so many concern. That's why, most of the adults are vaccinated, but the kids are not. So they're the ones that bring COVID to home.
Yeah,
Yeah,
especially when school opened, right,
yeah,
Doc?
yes, especially when it
Here's
opens.
here's
So,
another request, an opinion request from you by Jobert. Can I have your opinion on what I hear around that pharma companies are responsible for these variants? They're creating the variants.
no, mutations of the virus occur naturally. So,
Mhm.
it's not due to
So these are not laboratory created.
no, 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 no. These are the false information that discredit the vaccine. So again, we should be
Mhm.
careful on what we read. It should be coming from reliable sources. It should be
Mhm.
legitimate, and refrain from reading those false information, because again, it will just create doubts on you and make you crazy.
Thank you for your interaction, participation, Jobert. And so, Grace, do you have something to say? It's
I'm here. I'm still here. No
can you
worries.
can you hear me from Twitter?
Yes. Excuse me. So, yeah, I have another question for Dr. Barroso. Um, for those who have gotten the virus and those with mental illness because of the pandemic, does the Department of Health offer programs for them?
uh yes, there are a lot of programs and services that support mental health issues. In fact, counseling and support are available from the distress helpline, and you can call the 1-800 number, or you can
Mm.
also just call 311 for any programs and services about mental health. We also have financial assistance for food, housing, and bills when it comes to COVID. And you can also visit the USA.gov or call the 1-800-44-872-4681. And you can find all of the programs and all of the services that will help those that are affected, inflicted by COVID-19.
Oh, that's great. So, yeah, that's a very good information for those who are in need of medical support
Yeah,
after recovering from COVID-19. So, check out the number and the website, that's usa.org.
yes,
Yeah, and find out the right programs
right.
for you.
Yes, correct.
Mhm. Marivir?
Yes, I think I have exhausted all the questions already,
Mm-hmm.
and I would like to thank Dr. Barroso for her precious time with us, giving us how to manage ourselves, to take care of ourselves at these very crucial times that we are all in. Doctor, thank you so much.
Thank you, doctor.
Marvira and Grace, again, thank you so much for inviting me. And I will always be here when you need me.
Yes, for sure. We
Thank
will
you.
ask you again some other
Yes, thank
time.
you for your
Yes.
help, Doc. That's also like she has become my healthcare provider, Grace, because I was asking her what to do when I
Mhm.
had my symptoms.
Yeah,
Yes,
so
very,
So
she's,
happy to
yeah,
have
doctor
you,
is
Doc.
just
So
a
blessed.
text away. She's just a text, a call away.
yeah, it's just
So
a,
we appreciate that, doc.
yeah, that's good.
Thank you
Yes.
very
Yeah.
much, Doc, and see you around when things get better.
Yeah. Thank you,
Thank you for
Doc,
all
for
that
your
you do too.
time.
Thank you. Thank you so much for inviting.
Happy New Year to you and family.
Yes, thank you. Bye bye.
Happy New Year.
Happy New Year.
Bye bye.
Marivir. Oo. Some friends are asking me but wala daw ako and if I have COVID daw.
Oh my God.
No,
It's
I'm
not so
not. I'm
bad
not
because
sick
you're
of
having a
COVID.
show.
No, I don't have COVID. I have like some a mild back
Yes,
pain.
fatigue.
Yeah, overwork na.
Yeah, oh my God. So
Oo.
don't worry. Grace
Mhm.
is up and about.
Yeah,
She
let
just
me
doesn't feel like wearing a lipstick.
there.
And there she is. Oh, you have a lipstick.
I put I put on some lipstick
You're
for
back
you.
from Jupiter.
Yeah, I came from Mars actually.
Okay, cool, cool.
Okay.
So that's it for the day. That's it for the
Yeah.
evening.
Okay.
Take care
Thank
of
you.
yourself. Always drink water, as what Dr. Elvy said. Hydrate.
Yes. You
Hydration
too.
is really key
Yeah.
to
You have
wash out all
recovered.
the germs,
Yeah.
right?
You just
So
recovered from your colds and cough, right? So yeah.
me, yeah.
Hmm.
I'm
Yeah.
so I'm also a little scared, but I managed because like I didn't feel so weird. I
Mm-hmm.
felt a little weird, but not really that bad. So I realized that the vaccines are doing us good, Grace.
Yeah. The vaccine, and of course, take vitamin C at least 2,000 milligrams at
Yeah,
least
I do
a
take the
day. Yeah.
2000. You take
Okay.
2000 or more?
I actually take 3,000 milligrams a day. Yeah.
Wow.
Yeah. So
So you're superwoman. Plus
yeah,
the
knock on wood,
D3,
no? Yeah, not D3 and yeah, I take
the
vitamin
zinc,
C, D3. No, not the zinc
zinc.
though. The multivitamins.
And I also take my regular like herbs, Grace. I take the moringa,
Oh yeah,
like
that's good also. What do
moringa,
you take?
and
Can you share it with me?
yeah, I'll send you the link. And I
I
also take
wanna go organic also.
yeah, I take moringa and I take
Mm.
ashwagandha. That's for the
Ay,
thyroid health.
pampaganda.
Pampag
Ashwagandha.
oh, thyroid eh. Pampaganda.
Pampaganda.
Yeah.
Oh, yeah. It's
So
nice to
hopefully
see you.
we and our friends will meet again when
Yeah,
things are
hopefully.
okay and we don't get scared, no?
Yeah, hopefully next month, no? It's when it's not
Mhm.
really that cold. Kasi for the past few days, it's been really,
Yeah.
yeah, it's
Yeah,
so
it's
bad.
like
It's so cold. It's freezing
snowing
cold.
for the
Yeah.
past 2 days.
Mm-hmm.
Yeah.
Yeah.
And
So
windy, my
hopefully,
God. Grabe
yeah.
ang wind.
We haven't had our Christmas and New Year's celebration yet, right? So
Yeah,
we
it's
hope
okay. We'll move it to spring,
we hope
which is the
Christmas
real
in
new
spring.
year, start of
Christmas
the
in spring.
season.
Yes.
Yeah.
Okay. Yeah, you look
So
good.
that
So
thank
stay
you.
healthy, beautiful,
You
and
look good
active.
too.
Yeah. Oh my God, my back. Yeah.
Oh my God. Don't work so hard. Always have a
Yeah.
good sleep. Lots of water.
Yeah. I'll do
So
that.
before we go, I would like to share this, Grace. This is Dr. Elvis' greetings to us, and
Mhm.
then we'll just say bye bye to everyone.
Okay. So
Here we
we'll see you again next time.
see you next time, ladies and gentlemen. Thank you, Jobert, for joining, and for everybody else. Here we go.
Yes.
Take care, Grace.
You too. Great to see you,
Mwah.
Mom.
Congratulations, Mary Dear and Grace, on your first anniversary on Issues and Inspiration. Thank you so much for what you do, and more power to both of you.
That's Dr. Elvi. You're welcome.